to advance the slides, which to our record will be David. Please feel free to confirm that later. So welcome, sorry, yes.
Are you able to move the slides for me, because I'm using my phone actually?
Yeah. Yes, I saw other panelists sharing in the chat that they will be advancing the slides, so that would be fine. Thank you very much. So welcome everyone to the Minamata online events. The COP5 events are informal events that provide avenues for exchange of information, views, policy development, and new alternative stakeholders with parties. We are excited to share with you 22 events this week, but that also means that we have a really tight and dense schedule. So it would be highly appreciated if all the speakers could track the time. And then without further ado, I could give the floor to our moderator. Thank you. Sorry, one more thing to share with you, that all the whole section will be recorded and will be live streaming on YouTube. Thank you very much.
Thank you very much, Secretariat. Good morning, good afternoon, and good evening, dear colleagues. I hope you are able to get me. My name is David Kapindula from Zambia. I'm the African regional expert, and I'm going to be your moderator of this event. So this Africa Region Side event aims to outline the many pressing challenges of hazardous waste management, of end-of-life mercury-added products, especially in developing countries where there is limited or no infrastructure to support environmental sound management of hazardous waste. And at the same time, the session will also underpin the importance of prioritizing a phase out of certain mercury-added products, such as fluorescent lamps, dental amalgam, and cosmetics from the challenges of mercury exposure, of environmentally sound management and disposal. The session will also explore potential sustainable funding sources, economies of scale, and options of the ESM and disposal of MAPS and elemental mercury. This event is the partners for this event are Basel Convention Coordinating Center, BCC, Africa, Global Environmental Facility, Zero Mercury Working Group, Clean Lighting Coalition, and Environment and the Social Development Organization, and of course, the Minamata Secretariat. So without much further ado, we are going to have some opening remarks from Honorable Minister of Environment of Burkina Faso, Roger Barrow. Roger, are you on the floor? Is Roger available? Okay. If he's not available, because of in the interest of time, we can then move to our presentations. Perhaps Roger can come in later and make some remarks. And we can then move to our presenters. So our first presenter was supposed to be Mr. Christopher Kanema, who is Acting Director of Operation at the Zambia Environmental Management Agency. Unfortunately, I'm told he's unable to make it. So we have Wondi from Ethiopia, who's going to make the presentation. And this presentation is on challenges of managing waste from mercury-added products in developing countries. Wondi, you have the floor.
Thank you very much. Okay, this is Wendwasan Sintayo from Ethiopia. I'm part of the African regional experts on chemical and waste negotiation. So I am, stepping in the footsteps of Christopher, who has prepared these slides, but we share the same issues. So this is the title: Mercury Waste Management in Developing Countries. What are the challenges and what are the best practices, and what is Africa trying to do in introducing the three amendment proposals? So yeah, you can move on to the next slide. So as you can see in the picture, broken fluorescent lamps, dumped on the side. That's the reality depicting what our waste management practices look like in our continent. So the problem is basically environmentally sound and safe disposal of mercury waste is not occurring in many parts of the world. It's not occurring in the developed world. It's not occurring in Africa, in the developing parts of the continent of the world. This is our premise. As we can see from the Basel Convention, environmentally sound management of hazardous waste is really covered, and it means taking all practicable steps to ensure that hazardous wastes or wastes are managed in a manner which will protect human health and the environment against the adverse effects emanating from such waste. This demands technology, this demands knowledge, this demands awareness, and this demands infrastructure. That's what we are lacking on our part. So what are really the challenges? Basically, we have tried to, the next slide, please, indicate that we do lack the facilities for environmentally sound management of waste in general, but hazardous waste and mercury added products in particular. So that is lacking in our specific countries, where the practice of waste sorting and segregation at source is absent in most of the developing world. So what we do is we just dump it in a disposal site, which are not sanitary landfills, where waste is not really segregated, and at times and in most cases we burn the waste. So even giving the opportunity for fumigants and for hazardous gases to escape. Issues, you can go to the next slide. No, the previous one. Sorry, I'm sorry about it. And then the issue of environmentally sound sound management of waste storage is absent. That is a critical problem on our side. And when we talk about recycling, it's not cost efficient. We don't have the volume that would attract investment towards recycling old and broken down fluorescent lights, because that is, the recycling has become obsolete. The lamps have become obsolete, so does the recycling efforts. Public awareness is not existent, and most of the workers and waste management officials, they are exposed to the mercury that is escaping when breakage happens. Lack of accessibility for proper disposal, I have said that, and it is not an issue that we do have in our country. So mercury waste management under the Basel Convention, it is covered. If you look at the annexes, it specifically mentions mercury and mercury compounds as wastes in Annex 1. In Annex 3, also ecotoxic bioaccumulation, the nature of the effects of biotic systems as a hazardous characteristics describes what we are in. And Annex 3 considers liberation of toxic gases in contact with air or water, hazardous characteristics, which happens when fluorescent lights are broken. So it's covered in the annexes. So parties in general under the Basel Convention are required to ensure that the generation of hazardous waste and other waste within it is reduced to a minimum, taking into account social, technological, and economic aspects. So basically, it is really asking us to tackle it at source. That is the rationale for introducing our, African Amendment.
Wandi, we seem to have lost Wandi.
Can you hear me?
Yes, we can hear you. Can hear you.
Sorry,
Please
sorry.
proceed.
Yeah, it got interrupted. Basically, mercury-containing products such as fluorescent lamps, they do exacerbate the already existing waste management challenge in Africa and in other developing countries. We don't have the disposal facilities. We lack the awareness, and also we lack the infrastructure. Poor conduct and inappropriate disposal methods exercised during the handling and disposal of hazardous waste is increasing this very significant health hazards and environmental pollution due to the harmful nature of the waste that is typical of the mercury and mercury added products. So our best practice is, as we say, turning it off from the source. So minimizing and phasing out the use of mercury added products in general, but in dental amalgams, in lighting appliances, and in cosmetics, that is really the thing that we can do in order to save our planet and the health of our citizens. So that's basically it, and that is a rationale for the introduction of the 3 amendment proposals. Yeah, I have to run quickly on these slides. David, over to you. Thank you very much on my part.
Thank you, Dr. Bondi, for that presentation, highlighting basically the amendments, 3 amendments to that the African region is submitting to COP5. Thank you. Our next presenter is Rachel Kalande, and Rachel is currently the global campaign lead for the Clean Lighting Coalition. Rachel has over 15 years experience in international environmental policy decision-making, as well as in the implementation of projects related to environmental protection or sustainable development. And since 2005, she has been working on chemicals and waste issues, where she has coordinated and actively participated in the development of policies to phase out or phase down chemical pollution at the national, regional, and global level. So Rachel will be making a presentation on fluorescent lamp disposal. So Rachel, you have 7 minutes. You have the floor.
Thank you, David. Am I clear? My sound is okay?
Yes, yes, we can hear you.
Okay, thank you. So in my presentation today, I will zoom in on the waste management situation with regards to fluorescent lamps and highlight some case studies of mercury exposure during the handling of fluorescent lamps. Next slide, please. So it is difficult to find data on fluorescent recycling, but we managed to, in our research, to find several examples of data that shows lack of capacity for recycling obsolete fluorescent lamps. And all these low recycling rates that you see on this slide in different parts of the world, from Brazil to the US to Sri Lanka, underpins the global lag in recycling fluorescents, even in many established economies. And most obsolete fluorescent lamps are usually disposed in municipal landfills and open dump sites. Next slide, please. Next slide. So here I will be talking about the mercury exposure. And in this Armenian report about storage of fluorescent bulbs in households, basements points to the fact that most fluorescent waste isn't even making it into a designated waste stream where it can be handled in an environmentally safe manner. This case study, conducted by the NGO, the Armenian Women for Health and a Healthy Environment, documents accumulations of obsolete lamps in hospitals, universities, and homes as well, home basements, for example, etc., which leads to the risk of mercury releases in closed spaces. And this makes it even more potent. And as you can see here, that in case there are also this documentation of the health impacts as well, and in case of long-term exposure to mercury and accumulation of a large amount of mercury in the body, symptoms such as motility disorders, limb weaknesses and paralysis, hearing and vision impairment may occur. Next slide, please. So with regards to that previous slide, fluorescent lamps, just wanted to to mention that in this situation, they contribute to the contamination of atmosphere, land, water, and people, and mercury releases from lamp breakages may occur during use, when discarded in general household waste, during collection and transport of discarded lamps, and during recycling operations and from landfills and other disposal practices. In this slide about a case study in China, I wanted to highlight this the significant mercury absorption by workers in a CFL here. We're talking about the compact fluorescent lamps, a manufacturing plant in China. And according to the researcher, significantly higher total mercury concentrations in human hair were observed in the CFL workers in comparison with other residents. And this study connects the mercury from fluorescent manufacturing activities to the contamination of local rice, which is then found back the mercury in high concentrations in the hair of the residents who consume the local rice. Next slide, please. This is a case study from the US where high mercury levels were registered in recycling facility workers in Madison, USA, and 2 of the 5 workers had tremor upon physical exam. It is worth noting that the mean employment duration of these workers at the facility was 2 years. Next slide, please. I'm going to go a little bit faster because of time. This slide is talking about mercury exposure risks to highly disadvantaged community members, for example, women, children, and the poor. These people are chronically exposed to a range of pollutants as well, not just mercury. And this is people like the informal waste pickers from the urban poor, usually women, children, and the elderly, who take the responsibility of waste material recovery and earn very little without any health insurance or any social protection, and they remain largely invisible in official statistics. It is very important to note this aspect of inequity with regards to exposure to mercury in our communities. So this is a slide about the Basel technical guidelines that the previous speaker has talked about at large, Wondi. So I will not focus on this, but basically the reduction, it emphasizes on the best practice being the reduction and actually cutting it at source and phasing out mercury use in products. Next slide, please. The benefits of source reduction, I've outlined them here, which include elimination of future toxic exposure to the public, immediate climate and energy demand benefits, lasting environmental and bioaccumulation restoration, increased safety and waste streams increased safety of waste streams and worker health, and future protection of vulnerable spaces, for example, as you saw in the case of Armenia, in hospitals and schools. Next slide, please. And here I outlined the benefits of mercury-free alternatives, which is basically toxics elimination. And this aligns with several international conventions, for example, the Minamata and the Basel. There is also, with regards to fluorescents, the climate mitigation benefit, where a lot of CO2 reductions could be achieved, and we have calculated that with a 2025 phase out of fluorescent lamps globally, there would be 3.5 gigatons cumulatively of CO2 avoided cumulatively between 2025 and 2050. There is also the cost savings, that is the global electricity cost savings, because the mercury-free alternatives to fluorescent lamps are much more cost effective. They last twice as long, and so there is a lot to be benefited and to be gained by switching to mercury-free alternatives. And the other thing I want to say is that globally LED purchase prices are actually becoming very competitive and even cheaper than fluorescents. So to conclude, I think that was the last slide. To conclude, I wanted to refer to mention that mercury-free fluorescent lamps the way forward is clear here. I mean, no more, if there are no more fluorescent lamps or no more mercury added products where alternatives exist, then mercury-free alternatives exist, then that means that no more extensive waste management challenges once the existing stock, the fluorescent inventory, has been safely disposed. Thank you. Over to you, David.
Thank you very much, Rachel, for that very insightful presentation on fluorescent lamp disposals, giving us some case studies there. Very interesting indeed. We'll now move to our third presentation, and this is going to be made by Michael Bender. Michael is the director of the US-based Mercury Policy Project. He coordinates the Zero Mercury Working Group and is co-lead of the product partnerships. He has over 30 years experience in the management of mercury added products, including presenting US lamp recyclers and co-founding the North American Hazardous Materials Management Association. As its director, he helped plan the annual Household and Small Business Hazardous Waste conference in the United States for several years in the 90s. This afternoon, Michael is going to make a presentation on waste management challenges of managing end-of-life mercury-added products. Michael, you have the floor. You have 7 minutes, please.
Thank you, David, and good morning, afternoon, evening to everyone. Can you hear me?
Yes.
Okay.
Yes, we can hear you.
Thank you. So today, as David mentioned, I'm going to be covering the waste management challenges of managing end-of-life mercury-added products. And as the last speaker just indicated, the challenges of waste management are such that there's even more reason to prioritize phasing out mercury-added products. Next slide, please. So the Zero Mercury Working Group was formed in 2005 to achieve zero mercury emissions, demand and supply. We've been fully supportive of the negotiations and the implementation of the Minamata Convention. Currently, we have over 110 members from over 55 countries. Next slide, please. So just to illustrate, again, the importance of source reduction, this pie chart is taken from the 2018 Global Mercury Assessment Report. We're expecting a new updated version, but as you can see, the blue, which is the batteries, the orange, which is the dental amalgam, and the lamps, which is in yellow. These sectors comprise upwards of nearly half of the mercury in the product. So again, with the most of the global flow of mercury-added batteries has already been phased out. Discussions at COP4 and hopefully at COP5 will phase out mercury-added lamps in the near future. And the same situation with dental amalgam, where there's been a lot of work focused on phasing down the use of dental amalgam in many places. That has resulted in phasing out dental amalgam use. And as I'll discuss further on in the presentation, the mercury emission controls, for instance, on crematorium are cost prohibitive in most countries. We only have a few countries in Europe that have been able to afford those units, and it's very expensive. Next slide, please. So let's just talk a little bit more about the challenges with managing dental amalgam releases. As you can see from the figure on the right, there's a number of different pathways to water, air, and land and disposal, ultimately getting into the global pool and raining down into our water bodies and getting taken up in fish. And so On the left side is a table from the report we did on phasing down dental amalgam for UNEP in 2016. And the quantities, as you can see, are quite substantial in this sector. Next slide, please. So, yeah, I talked about the quantities involved, but we don't know what the up-to-date numbers are. We're hoping we get those numbers soon. But clearly, there's thousands of tons of mercury released each year from crematorium and dental amalgam. And as you can, I think you can make out on the far right-hand column, the installation costs, just not to mention the operating costs, but just the installation costs for siting these crematoria are quite high, and for most countries, as I indicated, they are cost prohibitive. And when you think about releases of dental amalgam, there's a certain percentage that gets released in the dental clinic and into the environment, and as you saw in the previous slide, but the majority of the mercury walks out of the dental clinics in people's mouths, and that's really where the largest release is coming from in the form of crematorium and open burning. Next slide, please. So we've heard a bit about the challenges of managing mercury-added lamps, and I represented the U.S. lamp recycling industry in the 1990s, so I'm all too familiar with these challenges. As I said, there are many release pathways. Lamps are fragile to handle, pose a risk to workers throughout the life cycle. Compared to the value of the product, there's relatively high cost for lamp processing, and this lower negative value of recovered materials from the hazardous waste lamps are often more costly to manage. As mentioned by the prior speakers, this is even more challenging in countries that lack hazardous waste management and disposal infrastructure. Next slide, please. So as Rachel mentioned earlier, the global recycling rates lag considerably. This is actually data from a recent paper, academic paper, that we're seeing only 20% of lamps recycled in OECD countries, 5% in developing countries, and 0% in least developing countries. And so what we've seen outside of the EU, where there is a advanced disposal fee, the rates of recycling are low because disposal costs are not built into the product purchase. Next slide, please. So we did a survey a few years ago for a presentation I did for the Waste Partnership. And pretty much consistently, the only area we didn't get results in was Asia, but pretty much you can see in the left-hand column, pretty consistently high price per lamp item recycled. And again, it just points to the challenges involved in countries that don't have hazardous waste infrastructure for licensed, permitted, highly technical lamp processing facilities to come in. Very expensive. Generally, they just focus on the large quantity business waste from your office buildings and that kind of thing, where you have 4-foot or 8-foot linears that can be taken out and LEDs can be swapped out. You can do a one-time collection there. They do have some examples with drum top crushers. They're mainly for volume reduction. Next slide, please. So just to do a cost comparison of recycling mercury in a compact fluorescent lamp versus other mercury added products, and this is from the US, there's about 4 to 5 grams of mercury in a thermostat compared to about 5 milligrams of mercury in a compact fluorescent light. A thermometer contains 500 milligrams of mercury, an amount equal to mercury in over 100 CFLs. And in the US, the estimated cost for recycling a CFL is around 50 cents, half a US dollar. And we have what we call the Thermostat Recycling Corporation in the US, which charges $25 US recycling fee, which results in the cost to recycle a thermostat at about a quarter of a US dollar. And the bottom line is 1,600 times more expensive to recycle mercury in a compact fluorescent lamp compared to a thermostat, and there's some references there. Next slide, please. So just briefly here to make the case for prioritizing MAPS, as we call them, mercury added product waste discards. As I mentioned earlier, at the very top, you can see the compact fluorescent lamp, and the linear bulbs, tubes have very small, yet not insignificant. Obviously, no amount of mercury is good in the environment, but when we talk about some of these other categories, these switches and relays, you can get a much bigger return on investment by investing in collecting relay switches, other products that have very high mercury levels in. And also to put a shout out here for collecting elemental mercury. That's probably your most cost-effective opportunity there. And next slide, please. So that's mainly it in conclusion, and I'm more than happy to answer any questions. Thank you very much.
Thank you very much, Mike, for that very interesting presentation, giving us a perspective on waste management challenges of managing end-of-life mercury added products. Very, very interesting. And I believe that we should be able, we've learned quite a lot, and the chat is open. If we have questions to Mike, please type them in the chat and Mike will be able to answer them. So we've listened to three very interesting presentations this morning, afternoon, evening, and now we'll move on to our panel discussion, which I'll be able to moderate. And this afternoon, we've got 4 panelists. We've got Ibrahima Sow, Senior Environmental Specialist from the Global Environment Facility. And Ibrahima works on the climate change and chemicals team, focusing on persistent organic pollutants. Ibrahima, a chemical engineer, is the former director of the Basel Convention Center for Francophone Africa and comes to the GEF Secretariat with 20 years of experience gained in the Senegalese Ministry of Environment, as well as the Secretariat of the Basel Convention in Geneva. And as a senior special fellow for UNITA. He has been an active participant in the international negotiations leading to the adoption and implementation of the Chemicals and Waste Convention and agreements, including the Stockholm and Basel Convention. And our other panelist is Percy Onyawa, who is Executive Director, Basel Convention Coordinating Center for the Africa Region, BCC Africa, based in Nigeria. And Percy is, of course, like I've said, he's the Executive Director based at the BCC in Nigeria, and is a Professor of Analytical and Environmental Chemistry at the University of Ibadan, Nigeria. At the BCC, Percy's work involves the technical support of African parties to the Basel Convention in the implementation of their obligations to the convention, especially on the sound management of various hazardous wastes such as e-waste, plastic waste, waste batteries, waste oils, etc. This BCC Africa Center, Africa's mandate is carried out through information dissemination, training, research projects, technology transfer at the University of Ibadan. His technical and research focus on environmental media assessment, analytical methods development, and waste management. So that is one of our very interesting speakers that we have this afternoon. The next one is Sadika Sultan, who's Executive Director, Environment and Social Development Organization, ESDO as abbreviated. And Sadika is Executive Director since 2006 of Environmental and Social Development Organization, is one of the leading women NGO leaders in Asia. Recently, she was named the first director of the Dhaka-based Asia Center for Environmental Health and is Vice President for Asia of the World Alliance for Mercury-Free Dentistry. Sadika is a vigorous name as a gender expert, environmental activist who has dedicated her life to make a sustainable environment in Bangladesh through policy advocacy in several fields. And of course, our last but not least speaker, as I've already introduced him earlier, is Michael Bender, Director, Mercury Policy Project and International Coordinator, Zero Mercury Working Group. So, ladies and gentlemen, welcome to this panel. Let me turn to Ibrahima. So, perhaps give us just in your way, what funding opportunities exist for Jeff for addressing hazardous waste in developing countries, in particular hazardous waste from MAPS? Ibrahima, you have the floor.
Hello, can you hear me okay?
Yes, we can hear you.
Thank you. Thank you very much, David. Good morning, all. Good afternoon, good evening. Number one, I would like to thank you very much for having me in this call and providing some insight about the JEF funding when it comes to mercury issues. I would start by saying that it's important to understand that funding of issues related to mercury or all issues related to convention for which the JEF serves as financial mechanism should start with the guidance that we receive from the COP Conference of Parties. In other words, we're receiving guidance from you guys during the negotiation. Now, in a nutshell, when it comes to mercury, I think, and of course, as you know, we function by cycle, and now we are in JEF 8. So for JEF 8 precisely, the focus for funding mercury issues, are mainly on reduction of and elimination of mercury from artisanal gold mining, elimination of primary mercury mining and associated trade, along with control of use of mercury from primary mining, phase out and eventual elimination of mercury or mercury compound used in manufacturing processes contained in Annex B of the Minamata Convention, and elimination of mercury and the use of mercury and in products and in sectors and supply chain, like I said in the summary. Now, regarding your question, I think the JEF is ready to support effort for existing end-of-life products and equipment, and those that will need to be taken out of use. This, of course, the JEF will support, as I indicated earlier, and this is in the list of priorities given by the Conference of Parties of the Minamata Convention. I think that there is need to be aware that currently the main option are long-term storage. And when it comes to managing, for example, mercury waste, and this, of course, you probably know better than me, that the main option is long-term storage of metallic mercury, or reconverting it into cinnabar and storage and storing the one. So long-term storage options are limited. You also know that as geologically stable areas are needed to accomplish the long-term storage. So this is what I can say. I think we are able to support efforts related to mercury waste based on what I have indicated. I also mentioned other area where the JEF can provide support. Thank you. Over.
Thank you very much, Ibrahima. We will definitely get back to you. But at this point, let me now turn to Professor Percy. Professor Percy, we've heard in the African context, in the African continent, why is the need to phase out mercury in cosmetics such an important issue for the African continent? This issue seems to be coming out quite a lot in many of our meetings. Why is it such an important issue? Over to you, Professor.
Yeah, thank you, David. I don't know if my video is showing. Are you able to see me?
No, we are not able to see you.
I have had some struggle with that, but let me just go ahead.
Yes,
thank you.
please.
Now, mercury elements, the liquid form, is not easily seen in cosmetics because mercury is usually present in the salt or the compound form. And it's also generally believed that the concentration of mercury in cosmetics is low based on the limits that are defined by the convention. However, the African continent actually has very strong reasons to worry and not underplay the significance of this. I'll give a few statistics. First, we know that mercury-containing cosmetics are targeted mainly at persons of darker complexion, such as Blacks, the African region. In sub-Saharan Africa, the population of the Blacks is about 1.1 to 1.2 billion. And elsewhere around the world, population is only about 250 million to 300 million. Africa is therefore the destination of choice for those who want to trade in cosmetics that contain mercury. Surveys have also shown that about 40 to 70% of Africans in the sub-Saharan region have been using one form of skin lightening product or the other, and about 50% of these are known to contain mercury. Now, the convention limits mercury in cosmetics to 1 ppm. But what is the exact concentration that actually comes into the continent and other developing countries? Surveys have shown that the concentration ranges in thousands of parts per million. And in fact, in some cases in Africa, concentrations as high as 50,000 parts per million have been found in different cosmetics, either cream, soaps, other items. Now, if we imagine that a tablet of soap, for example, might weigh about 150 grams, and if the concentration is about 50,000 ppm, then that tablet of soap is likely to contain about 750 milligrams of mercury. And you can imagine, even if that concentration is 10 times lower than that, that is a significant amount, especially if we consider what happens to that mercury. The mercury gets distributed on our bodies when we use or apply cosmetics, and there is no way of recovering mercury in cosmetics. It just goes down the drain and contaminates the aquatic system and contaminates the food in the household and so on. So this is a big problem because the risk is higher than even the risk associated with lamps, since all the mercury in the cosmetics will end up on the human skin. Now, what are African countries doing with regards to mercury in cosmetics? Many countries have recognized this to be a big hazard, big problem to the African continent, and have embarked on aggressive awareness-raising campaign and actions that have led to the serious regulations banning the manufacture and trade in cosmetics containing mercury locally. However, most of the mercury that comes into the African region are derived from imports from other parts of the world, including Europe, but especially countries in the Asian region, where the governments have not been very, very strict with regards to regulating or banning manufacture, and do not discourage advertisements, not discourage exports to other countries. And what the African region is concentrating on now is to get a global agreement, a global engagement in form of the amendments being recommended, such that other countries will accept the challenge of banning or enforcing regulations that will lead to especially the control of online trade in mercury added cosmetics, and take the responsibility to prevent advertisements, to prevent adverts, to prevent export to African countries. When this is done, the African region certainly be better for it in terms of contamination, mercury, environment, possibility of toxicity and harm to human beings in the African region. I think this is going to be derived from the amendments that are being suggested as text in the part 2 of Article A of the Minamata Convention. I hope that this gives you an idea of why the African region needs to be very worried and is doing something about mercury in cosmetics. Thank you.
Thank you very much, Professor Percy. That was very elaborate indeed. And I believe that we are learning quite a lot in as far as why the African region, the issue of cosmetics, mercury in cosmetics is very important to the region, giving us statistics there. We'll now move to the next panelist. This is Sadika Sultana. Sadika, kindly share us some experiences or case studies on management of maps in Bangladesh in particular. Sultana, you have the floor.
Yes. Thank you. Can you hear me? I'm audible clearly?
Yes, we can hear you. Yeah, we can see
Okay.
you as well. Thank you.
Yeah, okay. Thank you for inviting me. A very important event here. Yes, I think we are already know about the Bangladesh status. The Bangladesh recently this year, on April 2023, ratified the Minamata Convention, and it has also already they enter into the force of Bangladesh in 17 July to this year. So now, yes, we have a very good enter because already when Bangladesh signed the Minamata Convention, that from that time, government trying to see how the mercury products and mercury things are hampered in our waste management. Basically, in Bangladesh, mainly the products and also the waste management issue. And some of these are the transboundary movement and illegal trade. This is a challenge for Bangladesh. So very recently, in 2019, I think so, the Department of Environment, they have a study as a long year study. They found the dangerous level of mercury in both our air and water. And in addition, due to the absence of a proper disposal mechanism, mercury even ends up in our food items. So this is a challenge for Bangladesh. So, from it has also some of the laws and rules in Bangladesh. The Industry Ministry, the BSTA, Bangladesh Standard for Testing Institute, under by the Ministry of Industry, they already set up a standard, the mandatory standard is a 1 ppm for the other creams. Is this 1 ppm mercury they can use in mercury skin lightening cream. So it has already, but they are also struggling many other areas, which is our previous speakers already said. It's a online platform and other sources also they didn't control it. So, and also it has a very good initiative in Bangladesh in dental society, and ESDO, my organization, also did very good work in Bangladesh. Already dental surgeon, it's a 97.5% are dental surgeon, they are not using, they are not procurement also, they are not procure the dental mercury in their practice. So, and also Bangladesh Army, they already phase out in their dentistry sector. So this is also the very good study in Bangladesh. And also regarding the lightening, Bangladesh Department of Environment and ESDO also did a very extensive study in Bangladesh. When the energy efficient, we think about the lightening is very much popular in Bangladesh. We need it. So that time our government, the huge amount of fluorescent light, LED, they just distributed all over the country. But when they know about this, the mercury emission, so that time they stopped this the distribution, and now is our study found that it has found in all over the country, LED is a very popular now, LED bulb. But the question is that
Sidika,
what
you
is the
just have
risk
2
of amount?
minutes.
Okay, so this is the study I just share with you. Bangladesh has very become a new party, so they have initiated their work very initially. Hopefully, we will just go forward it very positively. Thank you.
Thank you very much, Sidika, giving us a case study on Bangladesh there. We have another panelist. We've already listened to a presentation which he made earlier, and this is Michael Bender. So Michael, what are the challenges parties face in collecting end-of-life mercury-added lamps and dental amalgam? You have about 5 minutes, Michael.
Thanks, David, and hello, everyone. Again, yeah, as several of the speakers have mentioned earlier, I think the challenges and one of the really important reasons to raise the question about waste management challenges is for countries and parties to understand that for every year we continue to allow non-essential mercury-added products to be produced and used, it's another year on the other end where you're going to run into the disposal challenges, and it's different for different product categories. In the case of dental amalgam, the average life of a dental filling, a mercury dental filling, is about 10 years, possibly 15 years. And so for many of these product categories, the challenge is to recognize the extraordinary extra additional costs involved in managing hazardous waste. And when we step back and we look at the Minamata Convention, which also has in addition to the phase-out requirements in Article 4, it talks about waste management of mercury-added products, elemental mercury, other categories of mercury containing waste. And as Abraham mentioned earlier, if we start to look at the challenges, at the very end of the life cycle, which is environmentally sound management, that's typically what I would recommend. And we did a lot of these programs in the U.S. that we don't start set up collection programs for mercury added products without having a clear picture on where that material, how that material is going to be collected, transported, stored, processed, and ultimately disposed of. And so where you don't have a permanent disposal at the very end of the life cycle, then you end up with a what we call perpetual storage situation, which in many cases, well-intended, you've got a facility, you're collecting thermometers, for example, and you're storing them in part of the hospital facility, and they keep growing, and you keep waiting for the end of life solutions, and then for whatever reasons, the resources, the financing, the permitting, the actual ability of the parties involved to be able to manage for the entire life cycle gets very challenging. And we have a number of examples out there where well-intended mercury collection projects end up being hazardous waste disposal sites. And so one of the areas, and I'm hoping that this forum tees up the question within the Minamata Convention, is how do we prioritize in the most cost-effective manner?
Mike, you just have 1 minute.
Thank you, David. And that's sort of where this whole seminar is going, is in the direction of, while we're prioritizing phasing out mercury added products in the short run, in the next 10 years, what are the most highest priorities for collecting maps? Is it one-time collection, sector specific collection, or ongoing collection? And those things need to be factored out in any kind, before you start any kind of collection scheme. So thank you very much, David. And again, I'm open to answer any questions.
Thank you very much, Mike. And I've seen that our time is really ticking away, and I wish we had time for more questions, but unfortunately we seem to be running out of time. And we've had very interesting conversation from our panelists who have looked at the funding opportunities that exist from the GEF, and also why the issue of cosmetics is very important in the African region. That was highlighted in detail by Professor Percy. And then Sidika also gave us a perspective of Bangladesh, the fact that Bangladesh is now a party, and they are moving in the right direction as far as MAPS is concerned. And then and our last panelist was Mike Bender, who basically highlighted the challenges that parties are facing in collecting end-of-life mercury-added lamps and dental amalgam. So I'm very grateful to to our distinguished panelists, and who took time to prepare and answer the questions. I believe that Honorable Minister Barrow is now online. He did not give his opening remarks. Perhaps I can just give him a minute or so to say one or two things before we actually close this session. Honorable Minister Barrow.
Okay, thank you, David. Thank you, everybody, to organize this side event. I take this opportunity you for the education. We have got some information on how our continent can realize some progress to implement Mercury Convention Minamata. So we thank also Jeff, Mr. Ibrahim Assou, for his assistance, and we think and we believe for the upcoming years we will have more funds to have project on the ground. because we can change the map on the ground by make Mercury history. Thank you for all of us, and thank you also for Clash to organize this meeting. Thank you, everybody.
Thank you very much, Honorable Minister, and thank you very much all our presenters and also the panelists. Unfortunately, our time has run out and we do not have time to ask any questions, but please feel free to send any questions to the Secretariat of the Minamata Convention, and we'll be able to get the responses from our distinguished speakers and panelists and presenters. So on behalf of our partners, I wish to thank you very much for attending this side event. Thank you so much.
Thank you, everyone. Thank you, David. Thank you, all the speakers and panelists for the great event. And thank you for all the attendees who are paying attention to our events. And we will encourage also at the same time to fill out the little survey when you quit the webinar to help us to keep improving our work and supporting the progress to make Mercury history. Thank you very much. And you're more than welcome to join other side events that are going to happen in the next few days. Thank you very much.
Thank you. Bye-bye.
Thank you. Bye-bye.
Yeah, thank you,
Bye-bye.
everyone.
Bye.
Bye-bye.
Thank you.
Bye-bye.
Bye.